For the first time in the history of the program, the number on your Medicare bill starts with a 200, not 100 and something, 200. As of January 1st, 2026, the standard monthly premium for Medicare Part B is $202.90. And by the time this video ends, you will understand exactly how that single number quietly reaches into your Social Security check, your hospital bill, and your savings, and why it almost certainly took more from you this year than the raise Washington just handed you. Here is the promise. In the next few minutes, you will know the exact new figures the Centers for Medicare and Medicaid Services set for 2026. You will know who pays the standard amount and who pays nearly $700 a month for the very same coverage. And you will know why the government protection that is supposed to shield seniors from this increase will not protect most of the people watching. You will also know what some people are already doing to soften the blow before the next round of increases lands. Start with the raw math, because the raw math is where the story hides. In 2025, the standard Part B premium was $185 a month. For 2026, the Centers for Medicare and Medicaid Services set it at $202.90. That is an increase of $17.90, and according to AARP, that works out to a jump of 9.7% in a single year. Say that number slowly. Nearly 10% in 1 year, on a cost that comes straight out of tens of millions of Social Security checks before the money ever reaches a bank account. Now hold that next to the raise. The Social Security cost of living adjustment for 2026 is 2.8%. Your Medicare premium went up almost 10%. Your benefit went up under 3%. You do not need a finance degree to feel where that leads. And according to AARP, this is now the third year in a row that the Part B premium has climbed faster than the cost of living adjustment that is supposed to keep retirees whole. That is the tension sitting under this entire video. A raise that looks like good news on paper, and a premium increase that quietly eats a large piece of it before you ever see a dollar. Most people notice the raise. Almost nobody does the subtraction. By the end, you will have done it, and you will understand why some retirees this year will open their January statement and find that after the new premium, they are barely ahead of where they stood in December, if they are ahead at all. Picture the moment it actually happens. Someone opens their account online in early January, expecting the new year to feel a little easier because they heard a raise was coming. They see the cost of living increase land in the benefit amount, and for a second it feels like good news. Then they scroll down to the deduction line, the one marked for the Medicare Part B premium, and they watch a chunk of that raise disappear before it ever becomes money they can actually spend. No letter warned them in plain language. No headline did the subtraction for them. It simply happened, quietly, the way it happens to tens of millions of people every single January. This year, that quiet moment involves a premium that crossed a line it had never crossed before in the history of the program, and that is exactly why it is worth understanding in full rather than in passing. So stay with me, because this is not a video about a number on a government form. It is a video about how much of your own money you get to keep, how a decision made in an office in Baltimore reaches into a bank account in your town, and how a raise you were promised can quietly turn into a raise you never fully receive. That is the real story of 2026, and it starts with understanding precisely what Washington set in stone. Let us be precise about what actually changed, because precision is the whole point of this channel. On November 14, 2025, the Centers for Medicare and Medicaid Services, the federal agency that runs Medicare, released the official 2026 figures. The standard monthly Part B premium, the one most beneficiaries pay, was set at $202.90, effective January 1, 2026. The Railroad Retirement Board, which administers Medicare for railroad retirees and publishes the same federal numbers, confirmed the identical figure. That $202.90 is not a small technical footnote. Part B is the piece of Medicare that covers doctor visits, outpatient care, lab work, preventive screenings, and much of the routine medicine that keeps people healthy as they age. Almost everyone on Medicare pays a Part B premium, and for the vast majority it is deducted automatically from their Social Security benefit every month. So when that number moves, it moves for nearly everyone all at once, without anyone having to opt in. There is a second number that changed at the same time, and it gets far less attention than it deserves. The annual Part B deductible, the amount you pay out of your own pocket before Medicare starts covering its share, rose to $283 for 2026. In 2025, it was $257. According to the figures released by the Centers for Medicare and Medicaid Services, that is an increase of $26, or about 10.1%. So both the monthly premium and the annual deductible climbed by roughly 10% in the same year. Two increases stacked, both near 10%, both landing in the same January. Why does that first number crossing 200 matter beyond the symbolism? Because psychology aside, it marks a threshold that reframes the whole conversation. For years, retirees and the people who advised them treated the Part B premium as a manageable line item, something in the 100 and something range that you factored in and moved on. Crossing $202 means a married couple where both spouses are on Medicare are now paying more than $405 every single month, more than $4,800 a year, just for the standard Part B premium, before a single deductible, before a single copay, before a single prescription. That is real money leaving a fixed income every month, and it is money that used to buy groceries. And here is the part that surprises people. You do not get to shop around. You do not get to negotiate. The premium is set by a federal agency, published in the Federal Register and applied across the country. There is no version of Part B where a careful shopper pays less than the standard amount. The only direction the number moves for you personally is up, if your income is high enough, and we will get to exactly who that hits in a few minutes. Understand why crossing $200 feels like a turning point. It helps to see where this number has traveled. Not long ago, within the memory of most current retirees, the standard Part B premium sat around $100 a month. It climbed past $140, then past $170, and in 2025 it reached $185. Now, in 2026, it stands at $202.90. The direction has been relentlessly upward, and the pace has quickened. Each individual year's increase can look modest in isolation, a few dollars here, 10 or 15 there, which is exactly why the cumulative climb is so easy to overlook until a round number forces you to notice it. 200 is that round number, and it arrived faster than most people expected. It also helps to understand what you are actually buying with that premium, because Part B is not a minor slice of coverage. It pays for the care people use most often: visits to primary care doctors and to specialists, outpatient surgery, diagnostic tests, laboratory work and imaging, preventive services like screenings and an annual wellness visit, durable medical equipment such as walkers and wheelchairs. Much of the ordinary machinery of staying healthy runs through Part B, which is why nearly everyone on Medicare enrolls in it, and why the premium is close to universal. It is also why an increase in that premium is not something a person can simply sidestep by changing their habits. The care Part B covers is the care people genuinely need, which means the premium is a cost you cannot easily walk away from. Now scale it up. When a single figure that nearly every Medicare beneficiary pays rises by $17.90 a month, and tens of millions of people pay it, the amount of money moving is enormous. For any one household, it is a line on a statement. Across the whole population of beneficiaries, it is billions of dollars redirected in a single year. That is why this number is not just a personal budgeting detail. It is one of the largest quiet transfers in the entire federal system, and it happens automatically, without a vote, the moment the calendar turns to January. This is the section where the two numbers collide, so pay close attention, because this is the piece almost no one calculates correctly. Every autumn, the Social Security Administration announces a cost of living adjustment. For 2026, according to AARP, that adjustment is 2.8%, up slightly from 2.5% the year before. On the average retirement benefit, AARP reports that 2.8% works out to an increase of about $56 a month. $56, that is the raise. That is the number in the cheerful headline. Now subtract the premium increase. The Part B premium went up $17.90. So of that $56 raise, nearly $18 is gone before it ever reaches you, absorbed by the higher premium that comes straight out of the same check. That leaves something closer to $38 of actual new money in the average retiree's pocket. And that is before you account for the higher deductible, before the higher cost of everything else a retiree buys, and before the higher part, a hospital costs we are about to discuss. Think about what that means over a year. The headline says your benefit rose by $56 a month. The reality, once the premium takes its cut, is that a large slice of the raise never arrives. The Senior Citizens League, an advocacy group for older Americans, put the pattern bluntly. Shannon Benton, the executive director of the group, warned that Medicare Part B premiums consistently overtaking Social Security cost of living adjustments degrades the quality of life of American seniors over time. Read that again. Over time. This is not a one-year problem. It is a slow grind, and 2026 is simply the year the premium finally crossed a number people cannot ignore. Here is the re-engagement question, and it is a real one. When was the last time you actually compared your December Social Security deposit to your January deposit, side by side, dollar for dollar? Most people never do. They hear that a raise is coming, they feel briefly reassured, and they never check whether the raise survived contact with the premium. This year, more than most, is the year to check, because the gap between the raise and the premium increase is wider than it has been in a long time. And remember the context. AARP notes this is the third consecutive year the premium has outrun the cost of living adjustment. So even if this single year feels survivable, the direction is the story. Each year the premium takes a slightly bigger bite, the raise covers slightly less, and the distance between what a Social Security check says and what it actually buys keeps widening. That is the quiet erosion sitting underneath the good news headline. And it is why the number crossing 200 is a milestone worth understanding rather than shrugging off. Let us make this concrete with a few examples, using round numbers so the pattern is easy to follow. Take someone whose monthly benefit is near the average, and whose 2.8% raise comes to about $56, the figure AARP reports. Subtract the $17.90 premium increase, and roughly $38 of new money remains. Now take someone with a smaller benefit, whose raise this year comes to closer to $30. That same $17.90 premium increase takes well over half of their raise, leaving them barely $12 ahead. The smaller the benefit, the larger the share the premium increase consumes, which means the people with the least room to spare are the ones who feel the squeeze most sharply. That is the cruel arithmetic of a flat dollar increase landing on unequal checks. Now stretch it across a full year. $38 a month is a little more than $450 over 12 months. That may sound like something, until you set it against a year of higher grocery prices, higher utility bills, and higher costs for the very medicine and care that Part B does not fully cover. The raise was designed to keep pace with inflation. But for retirees, medical inflation is the part of inflation that hits hardest, and it is precisely the part that the Part B premium is chasing. So the raise arrives already spoken for, and a large piece of it is claimed before the rest of the year's rising costs even enter the picture. What looks on paper like getting ahead can turn out in practice to be barely holding the line. And here is why this matters even if you are comfortable. The habit of doing the subtraction is what separates people who feel in control of their retirement from people who feel vaguely anxious every January without knowing why. The anxiety comes from sensing that the money does not stretch the way the headline promised, without ever pinning down where it went. The number crossing 200 is your invitation to pin it down, once and for all, so that the next announcement is something you can read clearly instead of something that quietly unsettles you. Most people, when they think about Medicare costs, think only about that monthly premium, but the premium is just the entry fee. The deductibles and the daily hospital costs are where a single bad health event can turn into a serious financial shock, and every one of those numbers went up for 2026 as well. Start with Part B again. Beyond the monthly premium, there is that annual deductible we mentioned, now $283 for 2026, according to the Centers for Medicare and Medicaid Services. You pay that out of pocket before Medicare begins paying its share of your doctor and outpatient bills for the year. For someone who sees doctors regularly, that deductible is spent early and felt immediately. Now move to Part A, the hospital side of Medicare, where the numbers are much larger and much less understood. Part A covers inpatient hospital stays, skilled nursing care, and related services. For 2026, the Centers for Medicare and Medicaid Services set the inpatient hospital deductible at $1,736. That is up $60 from $1,676 in 2025. And that deductible is not annual the way the Part B one is. It applies per benefit period, which means if you are hospitalized, recover, and then are hospitalized again later in the year in a new benefit period, you can owe that deductible more than once in the same 12 months. It gets steeper from there. According to the federal figures, if a hospital stay runs long, from the 61st through the 90th day, you owe a coinsurance amount of $434 per day. For what Medicare calls lifetime reserve days, the limited pool of extra days beyond 90, the coinsurance jumps to $868 per day. And for skilled nursing facility care, the daily coinsurance for days 21 through 100 rose to $217 a day for 2026, up from $209.50. Sit with those figures for a moment, because this is the part that quietly wrecks retirement budgets. A single extended hospital stay, followed by a stretch in a skilled nursing facility, can generate thousands of dollars in out-of-pocket costs even for someone who did everything right and enrolled in Medicare on time. This is precisely why many retirees carry supplemental coverage, a Medigap policy, or a Medicare Advantage plan, to blunt these exact numbers. But those plans carry their own premiums, and those premiums are rising too, which means the true cost of being covered keeps climbing on every front at once. Here is the number that should stick with you. The monthly premium gets the headlines because everyone pays it and everyone sees it. But it is the hospital deductible at $1,736 and the daily coinsurance at $434 and then $868 that can empty an emergency fund in a single difficult month. Washington did not just raise the visible price this year. It raised the hidden one too, the one you only discover when you are least prepared to absorb it. Walk through how these numbers can stack in a single difficult stretch, because seeing them in sequence is what makes them real. Imagine someone is admitted to the hospital. Right away, before Medicare pays its share of the inpatient stay, they are responsible for the Part A deductible of $1,736. Suppose the stay is serious and runs long. Once it passes 60 days, each additional day from the 61st through the 90th adds $434. If the stay is long enough to reach into lifetime reserve days, each of those days adds $868. Then, as often happens, the person is not ready to go straight home and is moved to a skilled nursing facility to recover. Medicare covers the early part of that stay, but from day 21 onward the daily coinsurance of $217 begins, and it continues day after day until they either go home or reach day 100. Add those pieces together and you can see how a single health event, entirely covered by Medicare in the sense that the person did everything right and was fully enrolled, can still generate thousands of dollars in personal costs. None of this is a penalty. None of it is a mistake. It is simply how the cost sharing in Medicare is built, and every one of these figures rose for 2026. This is the reason supplemental coverage exists, and the reason so many retirees consider it essential rather than optional. The premium is the cost you see every month. These are the costs you discover in the month you can least afford a surprise. There is also a trap in the fine print that catches people who assume they are covered. Medicare treats a hospital stay differently depending on whether you were formally admitted as an inpatient or simply kept for observation. Two people can spend the same 3 nights in the same hospital bed, and the one classified as an observation patient rather than an admitted inpatient can face a very different bill and may not qualify for Medicare to cover a skilled nursing stay afterward at all. Most people have no idea this distinction exists until it appears on a statement. It is one more reason the hospital side of Medicare deserves the same attention people give the monthly premium, even though it almost never gets it. Everything we have discussed so far is the standard premium, the $202.90 that most people pay. But there is an entire tier of beneficiaries who pay far more for the identical coverage, and the rules that decide who lands in that tier catch more people every year. This is called the Income-Related Monthly Adjustment Amount, known by the shorthand IRMAA, and understanding it can save a careful person real money. Here is how it works. According to the figures published by the Railroad Retirement Board and reported by AARP, roughly 8% of Medicare beneficiaries pay more than the standard premium because their income is above certain thresholds. For 2026, the surcharge begins once your income rises above $109,000 for a single filer or $218,000 for a married couple filing jointly. Cross that line, and your Part B premium is no longer $202.90. It steps up. And it steps up in tiers. Based on the official 2026 brackets, a single filer earning between $109,000 and $137,000 pays $284.10 a month. The next tier pays $405.80. Above that, $527.50. Higher still, $649.20. And at the very top, for a single filer with income of $500,000 or more, or a couple at $750,000 or more, the monthly Part B premium reaches $689.90. That is nearly $700 a month, per person, for coverage that your neighbor is getting for $202.90. Now here is the trap that catches ordinary people who do not consider themselves wealthy at all. IRMAA is based on your income from 2 years earlier. The 2026 surcharge looks back at the income you reported for tax year 2024. So a one-time event in that earlier year, selling a home, cashing out an investment, taking a large retirement account distribution, converting a traditional account to a Roth, can push your income across a threshold and trigger a surcharge 2 years later, long after the money is spent and long after you have forgotten the sale that caused it. This is why people who plan carefully treat these thresholds as bright lines. A retiree sitting just under a bracket might think twice before taking one extra distribution in December that nudges them over, because the cost is not just the tax on that distribution. It is potentially an entire year of a higher Medicare premium, 2 years down the road. The line between $202.90 and $284.10 can come down to a single financial decision made in a year most people are no longer thinking about. That is the kind of detail Washington rarely explains, and the kind that quietly separates the people who plan from the people who simply pay. There is one more feature of these brackets that makes them especially punishing, and it is worth understanding clearly. The surcharge is a cliff, not a gentle slope. Cross a threshold by a single dollar, and you owe the entire higher amount for the year, not a little more in proportion to how far over the line you went. Picture two people with nearly identical finances. One reports income just below a threshold and pays $202.90 a month. The other reports income $1 higher, lands in the next bracket, and pays $284.10 a month. Over a year, that single dollar of income difference costs the second person nearly $1,000 in additional premiums. That is what a cliff means, and it is why people who plan carefully watch these lines the way a driver watches a speed limit sign. It is also why an unexpected windfall deserves a second look before it is realized. A retiree who sells a long-time family home, for example, may generate a large gain in a single year. Even if much of that gain is shielded from tax by the home sale exclusion, the portion of income that still counts can be enough to push them across an IRMAA threshold, and the surcharge that follows 2 years later can catch them completely off guard. The tax on the sale was expected. The Medicare surcharge, arriving 2 years later on a bill they had never connected to that sale, usually is not. The same is true for a large one-time withdrawal to help a family member, or a strong year in an investment account. Income that felt like a fortunate event in the moment can quietly reappear as a higher Medicare bill long after the moment has passed. At this point, a reasonable person asks a fair question. Is there not a law that protects seniors from exactly this, from a Medicare premium increase swallowing their Social Security raise? There is. It is called the hold harmless provision, and the uncomfortable truth for 2026 is that it will not protect most of the people who need it. Here is what the hold harmless rule actually does. According to AARP, it prevents your Social Security benefit from dropping below what it was the previous year because of a rising Part B premium, but only when the premium is deducted directly from your Social Security check. In plain terms, the increase in your premium is not supposed to exceed the increase in your Social Security benefit, so your net check does not shrink year over year. On its face, that sounds like exactly the shield retirees need. But look at the arithmetic for 2026, and the shield develops a large hole. The premium went up $17.90. For the hold harmless protection to fully apply, your cost of living raise has to be at least that much. And $17.90 happens to be about 2.8%, this year's cost of living percentage, of a monthly benefit of roughly $639. So according to AARP, the practical effect is that only beneficiaries with relatively low monthly benefits, in the neighborhood of $639 or less, are actually shielded from feeling the full premium increase. For everyone whose benefit is higher, and that is most retirees, the raise is large enough in dollar terms that the full premium increase comes out of it. The protection technically applies, but there is nothing for it to protect, because your raise already covers the increase and then the increase takes it. And there are entire groups the hold harmless provision never covers at all. According to AARP, it does not protect people who are new to Medicare in 2026 because they have no prior year figure to be held against. It does not protect people who pay their Part B premium by quarterly bill rather than through an automatic Social Security deduction. It does not protect anyone who pays the income-related surcharge we just discussed. And it does not protect people enrolled in certain Medicare savings programs. If you fall into any of those categories, the shield is simply not there for you. It is worth naming why the rule is built this narrowly, because it reveals something about how these protections are designed. The hold harmless provision was written to prevent a very specific harm, a Social Security check that actually shrinks from one year to the next because of a rising Medicare premium. It was not written to guarantee that your raise stays in your pocket. Those are two very different promises. As long as your net check does not fall below last year's, the rule considers its job done, even if every dollar of your raise was consumed by the premium in the process. So a retiree can be fully protected by hold harmless and still end the year with essentially none of their cost of living increase left to spend. The protection guards against a fall, not against a standstill, and for most people 2026 is a year of standing still rather than falling behind. So the honest summary is this. The protection exists, it is real, and for a specific and shrinking group of lower income beneficiaries it does something meaningful. But for the typical retiree watching this, the hold harmless provision is not the safety net they imagine it to be. It will not stop the premium from taking a large share of the 2026 raise. Knowing that in advance is far better than discovering it in January, because it changes what you plan for and what you count on. If you have watched this pattern repeat, a raise arriving and a premium increase eating it, you may be wondering whether anyone is steering this, or whether it simply happens on its own. The answer is that it is largely structural, baked into how Medicare is funded and how medical costs move, and understanding the machinery tells you why next year is unlikely to look different. The Centers for Medicare and Medicaid Services explain the 2026 increase in fairly plain language. The premium rose because of projected changes in both the price of medical services and how much those services are used, consistent with historical trends. In other words, medical care costs more each year, and people use more of it as the population ages, and the Part B premium is set by law to cover roughly a quarter of the program's expected costs for the year. When the program's total costs rise, the premium that funds a fixed share of them rises too. There is no villain in a back room deciding to squeeze seniors. There is a formula, and the formula responds to a health care system that grows more expensive nearly every year. But structural does not mean harmless, and structural does not mean beyond debate. The Senior Citizens League has argued for years that the mismatch is the real problem. When medical inflation runs faster than the general inflation that drives the cost of living adjustment, and Part B premiums track medical inflation, while Social Security raises track general inflation, the two numbers drift apart by design. That is why the premium can rise nearly 10% in a year. The cost of living adjustment is under 3. They are measuring two different worlds, and for retirees, medical costs are the world that keeps winning. Here is the Ray engagement point, and it is worth pausing on. Notice that nothing about this requires a new law to make it worse. The erosion happens automatically, every year quietly, as long as medical costs outrun general inflation. That is what makes it so easy to miss. There is no dramatic vote, no signing ceremony, no headline that says your raise was just canceled. There is only a formula doing exactly what it was written to do, and a Social Security check that buys a little less each January than it did the January before. It is worth understanding one more piece of the machinery, because it explains why the premium is so sensitive to rising costs. By law, beneficiary premiums are set to cover roughly a quarter of the expected cost of Part B, while general federal revenue covers the rest. That sounds like beneficiaries are insulated, and in a sense they are, since they pay only a fraction of the true cost. But it also means that when the total cost of Part B rises, the premium that funds that fixed one-quarter share has to rise right along with it. There is no version where costs climb and the premium holds still, because the premium is tied by formula to a share of whatever the total turns out to be. When the whole pie grows, your slice grows with it, even though your slice stays the same fraction of the whole. Layer on top of that the simple reality of an aging population. Each year, more people age into Medicare, and older populations use more medical care, not less. More care used at higher prices per service means a larger total cost, which means a larger premium to fund the same fixed share. None of this requires anyone to act in bad faith. It is arithmetic responding to demographics and to the price of health care, and both of those are moving in the same direction, year after year. That is why the honest expectation for the years ahead is more of the same, not relief. Understanding that changes how you hear the annual announcements. When you hear that next year's cost of living adjustment is some modest percentage, the informed question is no longer how big is my raise. The informed question is how big is the premium increase that is going to meet it, and which of the two is going to win. In most recent years, the premium has won. The structure of the program is why, and the structure is not changing on its own. Knowing the numbers is only useful if you know what people do with them, so let us talk about the moves informed retirees and their advisors are considering. Nothing here is a recommendation, and everyone's situation is different. These are simply the paths people are looking at as they absorb the 2026 figures. The first path is about the income-related surcharge, and it is the one with the clearest opportunity. Because IRMAA is based on income from 2 years earlier, some people who experienced a major drop in income, retiring, losing a spouse, stopping work, can ask the Social Security Administration to reconsider using their current income instead of the 2-year-old figure. There is a formal process for this that involves reporting what the agency calls a life-changing event. People who have had such an event and are being charged a surcharge based on income they no longer earn often do not realize they can request a review. For those who qualify, correcting it can be worth thousands of dollars over a year. It is worth knowing that this process has a name and a form. The Social Security Administration uses a specific request, often referred to by its form number SSA 44, to reconsider an income-related surcharge when a qualifying life-changing event has occurred. The events that count include retirement or reduced work hours, the loss of a spouse, marriage or divorce, and the loss of certain kinds of income. Someone who retired last year and is now being charged a surcharge based on the higher income they earned while still working may have a strong case to ask for that reconsideration. The agency does not apply it automatically. The beneficiary has to raise their hand and file the request, which is exactly why so many people who qualify never receive the relief they would have been entitled to. The second path is timing, because a single financial decision in 1 year can trigger a surcharge 2 years later. People who are approaching or already crossing those income thresholds are paying close attention to when they realize income. Some are spreading out retirement account withdrawals across more years rather than taking a large lump in one. Some are being deliberate about the timing of a home sale or an investment sale. Some who are considering converting a traditional retirement account to a Roth are weighing the Medicare surcharge as one more cost of doing it in a given year. The point is not that any of these moves is right for you. The point is that the thresholds are now something to plan around, not discover by accident. The third path is for those with lower incomes, and it is badly underused. There are Medicare savings programs, run through the states, that can help pay Part B premiums and sometimes deductibles and coinsurance for people whose income and assets fall below certain limits. Many people who would qualify never apply, either because they do not know these programs exist or because they assume they earn too much. Given that the standard premium just crossed $202 a month, the value of checking eligibility is higher this year than it has ever been. For someone who does qualify, having that entire $202.90 premium covered is not a small saving. It is more than $2,400 a year that stays in the household, and for a person on a tight fixed income, that can be the difference between a budget that works and one that does not. The programs exist precisely for this situation, yet a large share of the people they were built for never claim them. And the fourth path is simply coverage review. Because the deductibles and hospital coinsurance rose alongside the premium, some people are re-examining their supplemental coverage during the enrollment windows Medicare provides, comparing what a Medigap policy or a Medicare Advantage plan would actually cost against the out-of-pocket exposure we walked through earlier. The goal is not to spend more. The goal is to make sure that if a $1,736 hospital deductible and $434 a day arrive, they do not arrive as a surprise you have no plan for. Some people discover, when they finally sit down and compare, that the coverage they chose years ago no longer fits the health they have today, or that a plan they once dismissed would now serve them better. Nothing about that choice is one size fits all, and what is right for one household can be wrong for the next. The point is only that the numbers changed for 2026, which makes this the year to look rather than assume last year's choice still holds. Across all four paths, the common thread is the same. The people who come out ahead are the ones who treated these numbers as information to act on, not just news to absorb. So where does this leave you, and what should you actually keep your eye on from here? A few things are worth watching closely, because they will shape what next year's version of this story looks like. Watch the gap between the two numbers. Every autumn, the Social Security Administration announces the cost of living adjustment, and the Centers for Medicare and Medicaid Services announces the new Part B premium, usually within a few weeks of each other. When they land, do the subtraction yourself, the way we did in this video. Take the dollar increase in your benefit and subtract the dollar increase in your premium, and you will know in about 10 seconds how much of your raise actually survived. AARP has now flagged 3 straight years of the premium outrunning the raise. Watch whether 2027 makes it 4. Watch your own December and January statements side by side. This is the single most useful habit, and almost nobody does it. The premium change is automatic and silent. The only way to truly see what happened to your money is to compare the 2 months directly. If you take one action after this video, let it be a calendar note to look at both deposits when January arrives. Write down the December amount today, so that when January comes you are not relying on memory, but on a number you can actually check against. That one small habit turns a vague sense that money is tighter into a clear figure you can plan around, and it costs you nothing but a minute and a note to yourself. Watch the income thresholds if you are anywhere near them. Remember that the 2026 surcharge is based on 2024 income, which means the decisions you make this year echo into your Medicare costs 2 years from now. If a large sale, a big withdrawal, or a Roth conversion is on your horizon, the surcharge brackets are now part of that math whether you want them to be or not. And watch for any movement in Washington on the structure itself. The mismatch between medical inflation and general inflation is the engine behind everything you just learned, and it is the kind of thing that occasionally draws proposals for reform. Whether any of them go anywhere is another question, but a premium crossing $200 for the first time is exactly the sort of milestone that puts an issue back on the table. And watch the enrollment windows. Medicare gives you specific periods each year when you can change plans, add or adjust supplemental coverage, or reconsider a Medicare Advantage option. Those windows are the only times most people can adjust how exposed they are to the deductibles and coinsurance we walked through. Missing a window usually means waiting a full year for the next chance. Given that every one of those out-of-pocket numbers rose for 2026, the enrollment period is no longer something to let pass by on autopilot. It is one of the few levers most people actually have, and it only works if you use it while it is open. The one thing to carry with you is this: a raise is only a raise if it survives the premium that meets it, and in 2026, for most retirees, a large part of it did not. You cannot control the formula, but you can control whether you see it coming, and now you do. Share this with someone who lives on a fixed income and has never once compared their December check to their January check. That single comparison is the most useful thing anyone on Medicare can do this winter, and almost no one has ever been told to do it. It takes 1 minute, it costs nothing, and it turns a number Washington said into a number you finally understand. This video is for informational purposes only and does not constitute financial, legal, or tax advice. Laws and policies change. Always consult a qualified professional before making any financial decisions.